Started. So thank you all for joining us again today. My name is Christopher Jammer, and today we have with us Dr. Rachel Westbrook, who is one of our Red River office doctors. So, of course, if you guys are unfamiliar with us, I see a couple of some new names today. So, if you are unfamiliar with us, Arasti, we are a group of healthcare providers that specialize in treating soft tissue injuries. So, anything from your head to your toes, as long as it's not a broken bone or a fracture that requires a cast or a full thickness tear that requires surgery, it's going to be things that we take care of. So, things like headaches, neck pain, back pain, all the way down the feet, and everything in between. Not only do we treat a lot of these conditions in our clinics, but we also like to do what we call our wellness talk. So we can talk to you specifically about different conditions that you either may be dealing with or things that could come up in the future so that you can be proactive kind of in your healthcare. So just to go over some housekeeping things before we actually get into the presentation. As you all saw, whenever you were admitted into the presentation, your microphones were muted. And that's so we can make sure to cut down on the bandwidth and we can get the information to you guys as quickly and as efficiently as possible. But if you have any questions for us, of course, throughout the presentation, anything, you can send those over in the chat function as well. For those of you who also are new, we ask that during the presentation that you send your first name, last name, and your employee ID number so that we can make sure to get your wellness credit for all of us on ISD for you to be able to watch this presentation. And so today, Dr. Westbrook is specifically going to talk to you guys about health at your desk. So just going over understanding kind of some effects of prolonged sitting on your bodies, conditions and things that might occur with those things, and then she'll go over some tools for prevention as well. So, and lastly, in the top right-hand corner of the presentation, you'll see a QR code. So that is to access what we call our virtual injury and pain chats. If you have a specific question that you'd like to ask that we don't actually go over in the presentation, and you would like to access that where you have a little bit more of a privacy type of conversation with one of our providers, you can scan that QR code and it'll take you directly to a website where you can schedule a time for yourself. So without further ado, I'm going to turn it over to Dr. Westbrook to take you through the presentation.
Awesome. All righty. So here's just a little overview of how this presentation will go. So we're going to talk about the effects of prolonged sittings on our body, some issues that prolonged sitting can crop up as far as musculoskeletal things. And then even if you don't have any pain currently or do have a little bit of an ache or pain, doing some tools for prevention and get a head start on any of the rehab that we might give you in the future. All right, so we will go to the next slide. All right, so first off, we're going to talk about some sitting here. So we'll go to the next slide. And why we should care, mainly because we all sit too much, kind of just a hazard of society. And unless you are really actively teaching in the classroom, a lot of you probably have a desk job where you're going to be sitting for about 8 hours a day. That's also including sitting with your meals, your drive to work, all those sort of things. So on a good day if you're one of the desk jockeys, then you're going to be sitting for about 8 hours a day. And that's not a position that our body really wants to be in for that long. Sitting can also cause other issues as far as diabetes, high blood pressure, kidney disease, those sort of things, which you should absolutely talk to your GPs about. But it can also lead to neck pain, low back pain. It can cause even plantar fasciitis long-term, those sort of things. And that's really what we're going to be talking about because that's what we can help with. All right, so we'll go to the next slide. And whose posture looks like this? We all kind of tend to end up in this kind of hunched over typing position. It's honestly an easy way to sit, but a couple things happen to us musculoskeletally in this position. So first, our head starts to come forward, our shoulders pitch forward, they internally rotate this way. Our whole spine is suddenly put in a really flexed position, and our hip flexors, which sit in the front portion of our hip here, they become very chronically tight as well. So all of these issues can lead to musculoskeletal pain. And we're going to talk about upper cross and lower cross next. All right, so upper cross. This is a cross pattern of where weakness and tightness kind of naturally settle into our bodies because of bad posture. So, and follow along with this diagram. So what happens in no particular order, but I like to start with the pecs because this is kind of the root cause of a lot of issues where everything we do is reaching forward in front here. We do dishes, we drive, we type. Everything that we do is in the front of our face here. So that shortens up our pectoral muscles, which run from our rib cage up into our shoulder. What that ends up in turn causes is weakness in the muscles that run in the middle of your back here. I also have a little muscle man diagram. It's got some drawings on it, so pardon me, but the muscles that sit here in between your shoulder blade and spine automatically become weak when we're reaching forward like this all the time. The other muscle group that becomes weak is on the front portion of your spine. If I were to like shove your trachea and esophagus out of the way, you have a small group of muscles called your deep cervical neck flexors. They're really important in holding your head over your shoulders in nice, pretty posture. And then, of course, the last thing that gets tight is all the muscles that run along our shoulder up into the back portion of our neck, which two things. A, we all like to hold our stress here. This is like where we kind of go, oh, this has been a very long day at work. Kids are screaming at me, those sort of things. Plus, the shortening of our pec muscles, the weakening of the low back muscles. Suddenly, the only thing that's really holding your head over your shoulders are these upper trap muscles and muscles that run along your shoulders and spine. And they're not designed to be the only thing holding the fort down, if you will. So these will become really tight, and a lot of the issues kind of stem from this whole corridor here. All right, now we're going to talk about the lower cross. So exact same thing, only for our hips and our low back, but it's the same kind of concept where we end up with this cross pattern of weakness and tightness. So let's start with the hip flexor. So the one that says tight iliopsoas, that's how it's pronounced. Again, those hip flexors sit in the front of our hip here and all the way up into our abdomen. And so when our leg is flexed in this position, when we're sitting, that muscle is automatically very short. And when you sit for 8 hours a day, your hip flexor learns how to be short. And what that does is it actually gives us what we call an anterior pelvic tilt. We also tend to have weak core, like everybody in America has a weak abdominal, unless you're, like a professional football player or an Olympic athlete, they have pretty strong cores. I'll give them that. But the weak core, the tight hip flexor, and then weakening of the glutes, because again, we're just sitting all day. And if you don't use your glutes, they're going to get weak and kind of go to sleep. They pull us into what we call an anterior pelvic tilt. So it's pulling us into this kind of J-Lo position here. So we got a nice big butt here, but everything is being pulled forward. Our low back does not like this position. It puts a lot of stress on both your spine and your muscles. Those are the tight erector spinae in the diagram. And so all of those, again, can kind of start leading to low back pain, hip pain, glute pain, all those sort of things. You can also look up the term gluteal amnesia, because again, if you sit on your butt all day for 8 hours, your glutes literally kind of forget how to operate. And it's not that they can't squeeze or they can't contract, but your body basically forgets what order your muscles should fire in when you're trying to walk or run or lift your kids, so doing those sort of things. All right, so now we're going to dive into some actual named conditions, because if you were to look up like the ICD-10 code or the diagnosis codes of upper cross and lower cross syndrome, you're not actually going to find anything, because a syndrome is a collection of either diagnoses or biomechanical issues that lead to then true diagnoses. So a tension headache is an actual diagnosis that upper cross syndrome can cause. And what you're looking at here are some muscles in the back of your neck in your head called your suboccipital muscles. You have a lot of nerves that run through this area. And if those muscles are too tight, because our heads are jutted forward like this, putting tension through our neck and our shoulder and the base of your skull, it's going to start causing some headaches. Some of the presentations of these headaches, it can be kind of different for everybody, especially if you're way tighter on your right side. It's probably going to give you more of a right-sided headache. Some people will say that they feel like there's a hat that they're wearing that's too tight. They call it a hat band headache, very clever. And so it's just one of those where you're kind of rubbing your temples, rubbing the side of your head. Another common pattern that I see in my office a lot is almost, it's like it kind of hooks from behind your ear up into your temple or behind your eye. That's also coming from that neck and upper trap area. So these headaches might present differently in everybody. Other things that can make them worse is like if you are looking at your computer all day and you don't wear like the blue light blocking glasses are really great. It can also be affected by your hydration levels. If you've worked out in the last couple of days, stress, hormones, all those sort of things. But if it's following a pattern of, and it gets worse through the day as I look at my computer or I wake up with this headache, those are good signs that we're going to be able to help you. And so if you have any kind of headache, it's usually, again, on the dominant side. It can be on both, but more intense on one. It's typically kind of like a dull pain, throbbing. Some of the stretches that we show you later, we're going to help out with this one. All right, and we'll go to thoracic outlet syndrome. This is one of my favorite conditions to treat because it responds so quickly. But again, a little bit of anatomy here. So the pecs that I was talking about earlier, the things that are drawing our shoulders forward into this nasty posture here, you have two pec muscles. So you have your pectoralis major. That's the one that people can really kind of see, especially if you do a lot of like pushing exercises and have a low enough body fat count here. But the pec muscle that we're really interested in here is the pectoralis minor here that's labeled nicely in the diagram. You also have a group of your nerves and your blood vessels that pass underneath the pec minor. That's what feeds your upper extremity in your arm and hand. So thoracic outlet syndrome, it's typically going to present with numbness, tingling. Sometimes it's up here in the arm. Sometimes it's your whole hand will go numb into your forearm. It's really common for this to happen at night, especially if you're a side sleeper and you tend to kind of ball up like this. But we also see it if you are like mousing. This happens a lot with your mousing hand. You might have to take breaks, shake it out a little bit. A lot of times this is mistaken for carpal tunnel, and there's some really good tests that I do to differentiate between, all right, is this really coming from your wrist? Is it coming from your elbow? Is it coming from your shoulder? But a lot of times it's coming from your shoulder, especially if you get that entire arm kind of going numb. But going through that pec muscle, getting it stretch out. I use my thumb to kind of strip it out. Usually people get results really fast with this one. Giving people good stretches as well can help kind of just get that shoulder to sit back, take the pressure off of those nerves and blood vessels, and you typically feel much better quite quickly with this one. Alrighty, and now we'll go to mid-back pain. So this is probably one of the most common things that I see in my office, really spine pain, which we'll address low back pain as well. But this is something I see at least a couple times a day. A lot of times this happens, like you can have these big flare-ups when it's like, well, I just kind of woke up this way, or I sneezed, or I reached forward. And a lot of times it'll kind of set off of a cascade of events where you can be in a lot of pain for a few days. But it also presents as just that kind of constant need to like adjust your shoulder while you're typing. These people, you know, you kind of tend to rub back here. It might not be that severe, but it can be very dull and nagging all day long and does tend to get worse with prolonged sitting and computer work. And again, it's just caused by that imbalance of strength and weakness in those muscles. So this is a really good diagram of those muscles that I was talking about that become really weak when we're reaching forward all the time. And so doing some pulling motions can really help to strengthen those muscles and help them support you in your good posture as well. So other things that might be happening here, very rare that we see any kind of like a disc issue. And sometimes that can cause that numbness, tingling going down the arm. That's, again, we'll do exams to make sure there's nothing crazy going on in the disc there. Alrighty, so low back pain. This is, again, probably maybe the most commonly treated thing in my office, very close second to that neck and upper back pain. And again, so talking more about that lower cross syndrome and the anterior pelvic tilt, that gluteal and amnesia. But when we sit all day and then we try to stand up, some of you guys might actually identify with this right now where you've been sitting for a couple of hours, you need to get some water, and so you go to stand up and you kind of go, oh, and you almost have, it's like it's a ratcheting trying to get up to stand up. Again, that's because your hip flexors are too tight and they're pulling everything forward. And so you tend, these again, they tend to be either like kind of low level, nagging, chronic, something that you just kind of tend to squirm all day in your seat because your back just is not comfortable. Some people would even say it's not painful, it's just tight. It's just tight and it's so distracting to you. And then sometimes, again, you sneeze. For this one, it's not so much, sometimes reaching will do this, but a lot of times people come in, they're kind of stuck in this position, you know, 8, 9, 10 pain on the pain scale. And they're like, it's because I spit the toothpaste out. It can happen with just that last straw on the camel's back. This one is a more common to see disc herniations. So if you do have any kind of pain that's radiating into your butt, into your hamstring, into your thigh, numbness, tingling in your feet, that's definitely something that you should come and see us for because we can get you helped out there. But a lot of the treatment here comes with strengthening your core and strengthening your glutes. Again, just kind of fight back against that lower cross syndrome. Alrighty, so now the preventative strategies. This is my favorite part. So feel free to play along here. And if you have any questions about any of this, feel free to ask. But as we do this, this next stretch, I'm okay if you get like a little bit of tingling in your hand with this. But if you have any pain doing any of these, just don't do them, call me, okay? All right, so first, the seated neck stretch. So with this one, I personally like to kind of just grab the edge of my chair with one hand. Everybody kind of has to figure out the best way to do this from themselves though, because everybody's wingspan's a little bit different. And so if this doesn't work for you, you can hold on to, like, if you have like a small dumbbell or a kettlebell, you can hold on to that. You can grab your belt, step on that, and then pull. You can sit on your hand. So there's ways to workshop this one, but where you're gonna feel this stretch is all along behind your ear into the tip of your shoulder. And what you're going to do is, so I'm going to do my right side first. I'm going to grab the edge of my chair with my right hand. I'm then going to kind of lean away from that side. I'm going to let my hand pull my shoulder down. That's going to take some of the tension out of the muscle already. And then you're just going to really gently bring your ear to your shoulder. You can do a tiny bit of overpressure with your other hand here, but you should feel a really nice stretch in your neck and in your shoulder here. Like I said, if it's painful, especially if it's painful like on your left side here, then don't do this. We're not quite ready for it, and you're going to need a couple treatments to get things to move and groove for us here. But I like to hold this for about 20 to 30 seconds, and then I play around with it a little bit. And everybody's a little different, so the stretch that feels the best for you might not feel the best for me. So that's kind of cool. You're going to kind of play around. And now I want you to rotate your nose towards your opposite armpit. So I'm going to sniff my left armpit, give or take, and then kind of dance that nose and chin around until you find the money stretch. Mine is really kind of directing right towards my armpit. Some people, you might come down further towards your chest here, but you're going to hold this one for another 20 to 30 seconds. And it's going to change. You should feel the stretch shift from directly to the side of your neck to the very kind of like almost to the back of your neck here. Again, hold it for 20, 30 seconds. Come out of that stretch, give it a little movie groove, and then you're going to dive into the other side. So I took my left hand, grabbed the edge of my chair, leaned, and then leaned my head over. If you don't grab, like, not mission critical, if you don't have anything to grab onto to help traction down on that shoulder, you don't have to do that technique. You just are going to have to pull and tug your head a little bit extra to kind of get that stretch to be a little bit more effective. The other tip that I have is, again, if you don't have anything to grab onto, or if you just have like a really wide wingspan that makes it hard for you to find the right like the right chair to use, what you can also do is literally just reach that hand behind your back. You can even kind of grab your belt loop or grab onto your belt, and then again, just bring that neck into a nice gentle stretch here. Hold it for about 20 to 30 seconds, and then you're going to rotate your nose down towards your right armpit. So the thing I do see patients do or try to do is they'll grab the chair with their left hand and then go to the left shoulder. That's going to feel funky. And so if you don't feel like you're getting a good stretch, that means you're doing it wrong. Go to the opposite way. So think about lengthening everything here. Alrighty, so that one you can do easy peasy sitting at your desk, especially if you're at a meeting with your camera off. And now we'll go to the next slide here, which is the hip flexor stretch. This is another one that can be kind of tricky for people because everybody's built just a little bit differently. And so I'm going to show you guys a couple of versions of this stretch. The picture is kind of a classic kneeling hip flexor stretch. If you have not the greatest knees, then I recommend either using a pillow, or I'll also show you the standing version. I'll actually do the standing version first. This one, and if you need something to hold on to for balance, grab a wall, grab the edge of a chair. I'm going to do this with my left leg first because y'all can kind of see it a little bit better. But I'm going to put my left leg behind, so just kind of a good lunge Fincher stance here. And then what you're going to do is you're going to rotate your pelvis under. You're going to basically Michael Jackson your pelvis. So from a standing neutral position, I am trying to scoop my tailbone down towards the ground. We call that a posterior pelvic tilt. So right now we're all stuck in anterior pelvic tilt because this is too tight. And so we're going to do that opposite motion, the posterior pelvic tilt. So little lunge stance, posterior pelvic tilt, and you should feel a good stretch kind of in the front of your thigh into your hip. If you're struggling with that pelvic tilt motion, because it is kind of challenging, my other tip is you are going, so right now I'm stretching my left hip flexor. I can also squeeze my left glute to help push my hip forward and give me an even deeper stretch here. Something that you can play around with is the angle that you have your feet at. So I get a pretty good stretch, which is kind of like a normal Spencer stance here, but if you're also struggling, again, you can take another step out, widen that stance a little, makes the balance a little easier, and you might feel a little bit of a better stretch with that. Option number 2, and this one is personally my preferred stretch position, is on a softer surface where I can kneel here. So maybe I'm gonna make sure my angle's right here. All right, so, and again, use something for balance here. Y'all get to, sorry, I wear Crocs at work, so y'all are gonna see my soft feet here. But same thing, so just a nice lunge stance. I'm going to squeeze my left glute and get a good stretch through this right hip here. If you're still, again, finding it hard to find that stretch, that's when you can bring that other leg out a little further in front of you, start to lean a little bit more. Again, you can even widen that stance, get it through the front of the hip if it's, again, a little hard to find. So play around with that. There's some laying down versions that you can also do. I find this a little challenging if you don't have the right bed or the right couch for it, but on a harder surface, if you have like a bench or something like that, you can also lay down, hug one knee to your chest and let the other one just drape off that table, and you can get a good stretch through your quad and your hip flexor with that. So it's a really good one to do if your bed is firm enough and you're not gonna like roll off of it. But that one's a little challenging to do for some people just based on their like tools and supplies around them. All right, so that's the hip flexor stretch. That one is my favorite. Executive stretch. All right, so this one's a good straightforward one, again, that you can do, especially if you're sitting at your desk during a meeting where you're not having to type, and if nobody can see you, even better. So in a normal chair, let's see if I can get the angle here. You're just gonna have a seat, pop one leg over the other, and I'm gonna show you guys both sides, and you might notice this is my left leg. It's laying relatively flat. I get a good stretch kind of from the back of my hip and glute into my the side of my thigh into my IT band here. Feels pretty good, but so you see how flat this knee is? Nice. She's nice and stretched out. All right, so now over to right side. And again, hold all these stretches for at least 30 seconds. More like a minute or 2 is even better for like the hip flexor and the glute stretch. You can hold those for quite a while and it's gonna be really good for you. So now my right knee. So again, just to compare, nice flat right side. Do you see how high up she is? She's popped up. So this is my tight hip. It does give me some issues at night when I'm trying to get relaxed. And so this is a really good stretch for me. And I really don't even have to do much to feel a stretch. I lean forward a tiny bit here. Sometimes I'll push down into that right knee as well, get a good stretch. But because this is my really, really tight side, what I would recommend you doing, so if you guys are doing this and you notice one of your knees is way higher than the other, that's going to be your tight side. Start with that side, hold it for a minute, then jump back over to your left side, your non-tight side, hold that for a minute, and then bounce back to your right side. So that way you can start to kind of even your pelvis up a little bit. The hip flexor and the glute stretch are really good. Like, I don't know if any of you guys have this experience, but of standing on one leg that almost feels like it's a little short compared to the other. Like my left leg always feels like it's a little bit longer. So I tend to kind of like, almost like I'm leaning to my right side sometimes. And it's really because my hip is so tight that it's like my hip joint is being sucked into its socket and not just kind of locked down, not moving. And so both the hip flexor and the glute stretch are going to be good for anybody who feels like they're like off balance or off kilter, or their hips are rotated weird. Start out with the hip flexor stretch and then do the glute stretch first. So I do recommend you do them in that order. Alrighty, so now we'll go through some strengthening exercises, which stretching is all well and good, but if you do not strengthen the muscle, it's never gonna get any longer because it's just gonna basically be like, no, we're clinging on for dear life here, lady. I'm not gonna stretch out because if I do, then your whole body is gonna fall apart. So doing some strengthening in conjunction with your stretching actually makes it a lot more effective for both. So for the chin tuck, and this is a little exaggerated just because it's a picture, the movement's gonna be a little bit more subtle for that, but going back to that upper cross, it's those deep cervical neck flexors. This is targeting that exercise. So this is a postural exercise that's going to help you hold your head over your shoulder. And you don't need to jut your head forward to do this. You just start from a normal neutral position. And we call it a chin tuck. You're really not tucking your chin down per se. You're really retracting backwards. So you want like your whole face to move about an inch backwards. And if you struggle with this, my tip is to put 2 fingers, one on your forehead, one on your chin, and you want to move your whole face away from those 2 fingers about an equal distance. So it's going to look a little something like this. So nice, sit up tall. I'll just go ahead and put my visuals here, and then you're going to retract. It's kind of hard to talk like this, but you're just going to retract your whole head, pushing it backwards, and then relax, and then retract the whole head. And honestly, this feels funky, but it's a pretty subtle movement. So not much movement at all. If you're getting pinching or pain in the back of your neck, cut it out, call us, because we'll need to go through some of those tissues to loosen it up to make sure it's not pinching anymore. But if you feel some tightness in the front of your neck and throat, that means you're doing this correctly. Some people don't feel a whole lot going on with this at all, and it's very much a trust the process kind of exercise, and you should do it anyway because the doctor told you so. And I recommend people do this about every hour that you're sitting and doing computer work. So if you're taking that coffee break, go ahead and do 10 chin tucks. You just have to hold it for about a snap, maybe 2, release 10 of those about every hour. And what that's going to do is neurologically, it's going to tell them, hey, wake up, do your jobs. You got to be on your, if I have to be at work, so do you, kind of thing. So if you do these every hour, it's basically telling your muscles like, hey, you got to do your job. I'm awake and you need to be present. All right, so now we'll do the seated row next, I believe. All right, beautiful. Okay, so similar thing. You can do this every hour that you take a break, and it's going to activate those middle back muscles, the rhomboid, the lower trap, those sort of things that sit in between those shoulder blade and spine. And again, this is just going to help you maintain really good, pretty posture through your workday. And so all you're going to do, and I always instruct my patients to keep their elbows pretty tucked into the side. You don't want to be doing the chicken dance or anything here. If you just literally slide your elbows backwards, try to reach them towards the opposite wall, squeeze those shoulder blades together, hold it for a couple seconds, and then relax. And again, squeeze and pull back. And if you think about driving your elbows back towards the opposite wall, it's going to be kind of hard to mess this one up. And you should feel some tightening and some muscle work happening in between your shoulder blade and spine. And you'd be surprised if you do not exercise regularly, no judgments here, but you might be surprised at how sore you can get by doing this again every hour or so, just because again, those muscles are just not used to being used as much as they should. And so you might actually be surprised at how like muscle achy, sore, like you've been working out that you can do from just doing this one exercise. Alrighty, and now we'll go into some, okay, so banded exercises. This is really going to up the ante on things. And with this Brugger exercise, you don't actually need a band, but it does kind of help fire things up a little bit more. We also call it the Fonzie. So you're going to, again, keep the elbow tucked in for the first part. And then what you're going to do is you're going to externally rotate your shoulders. So you're going to go, hey, squeezing those shoulder blades together. And then you're actually going to just kind of do a little waiter move here. And then come back. Squeeze those shoulder blades together and then press out a little bit. If you have a band, you can absolutely use a band with this. Sometimes it's a little hard to figure out how to get the tension right, but the whole time I'm really trying to keep my shoulder blades down and back, like my shoulder blades tucked in like wings. Alrighty, and I think there's just one more. The glute squeeze. This is probably the funniest of the exercises, to be honest with you. And we call it a seated press up. I like to call it glute squeeze. Again, every hour, this is going to combat that gluteal amnesia that we were talking about. And this sounds really stupid, but squeeze your butt cheeks. Squeeze your butt cheeks together 10 times. Do you see how I raise up about an inch or so? That means, not to brag, but I've got pretty okay glute activation. I personally can feel my right side doesn't quite fire the way my left does, again, because she's so tight that she's already contracted halfway. And so it almost feels like she's not doing all of the work that my left glute is doing. And so mentally, I kind of focus on making sure my right side is squeezing just as hard as my left. This is also something that you can do if you have a standing desk, if you're doing dishes, if you're folding laundry, standing up, something like that. You can also literally, if you're brushing your teeth, squeeze your butt cheeks together. And what this is going to do is it retrains your brain, like, hey, you have a butt. Go ahead and use it, because think of your glutes as the gas pedal. Like, all of our forward momentum should really come from your glutes. And when we sit all day, again, they just kind of get lazy and they forget when to work. They don't really forget how to work, they forget when to work. And so doing these glute squeezes, both seated and standing, are going to help kind of like wake them up and kind of remind them like, hey, it's time to go to work here. And I think that's the last exercise. So I'm going to pass it back to Chris Jammer, unless we have any questions about any of the exercises that we've done. Feel free to go ahead and pop those in the chat right now, and we can go ahead and chat them.
All right, thank you, Dr. Westbrook, for that. And of course, as she said, if you guys have any questions, for sure, shoot them over to us in the chat and we can get those answered for you at the end of the presentation. So again, like we talked about before, who we are as a ROSTI. So similar to how Dr. Westbrook was talking about the different conditions that come into our office, the reason why we go over these things and kind of make sure that we get to the source, whatever you got going on, is that so we can get you back to doing the very things that you love to do. So because of that, we've seen over 1 million patient cases as of March of 2021. And on average, we see our patients maybe 3 to 4 times get you to total pain resolution. So a lot of the times whenever our patients come in, they might have either gone to a specialist beforehand, we might have either received an MRI or an X-ray, but what our job is to make sure that you don't kind of get stuck in the hamster wheel of healthcare. So because of that, about 8 to 9 patients out of the 10 that come to us will receive a total pain resolution, and about 99% of people will would recommend us to our family and friends. So there's about maybe a 10, 11% of people that we technically can't always help in our offices, but we can point you into the right direction. So we definitely pride ourselves on that. And today specifically, Dr. Westbrook talks about some conditions that are associated with the upper cross and lower cross syndrome, such as tension headaches, lower back pain, some mid back pain as well. But as we said before, we take care of anything from your head to your toes, as long as there's not a break within the bone that requires a cast or a full thickness tear that was going to require surgery. So it could be something acute like neck pain that you woke up with in the morning, or it could be something chronic in nature like sciatic like pain, plantar fasciitis, things you've been dealing with for months, years, or even decades on end. So, and lastly, a ROSTI is an in-network benefit for all of Austin ISD's employees, spouses, and dependents who are on the Aetna Health Plan. You don't need a referral for most plans. Unless you're on an HMO plan, then you would need a referral to come see us, but that's generally really easy to get. Of course, we have over 35 locations in the Austin area, and as you can see on your screen, Dr. Rachel Westbrook's office is right off of 32nd and Red River. But of course, we're making sure that regardless of which office that you come into, we're providing a safe environment for not only our treatment teams, but also our patients. So if you guys have any specific questions, you also can go to the website to get those answered at rosti.com, or you can call our 800 number as well. So of course, if you have any questions, send those over to us in the chat. But if not, I will give you guys some of your time back. And thank you all for joining us.